Our project is measuring frailty within the community of Lanarkshire. We will be using a wearable medical grade biometric sensor that measures the health and well-being of individuals within the community. And then we aggregate the data via an innovative IoT platform. During that process, we're working with the University of Strathclyde in looking at some of the data science and analytics behind some of that information. And then we're visualising that data and identifying digitally where they are in what we call the Rockwood score, which is a universal standard for measuring frailty. So the main outcomes that we're looking to achieve with this programme is to be able to demonstrate the capabilities of digital health solutions, and in particular, the ability to capture health and well-being data of an individual using medical grade biometric sensors that will allow social care teams or healthcare providers to access information on that individual on a go-forward basis into the future, and how that enables efficiencies within their organisation.
Our role in the partnership is one that focuses on the data that's been acquired and tries to derive information and insights from that data. The strong interest in this project is the impact that we can produce and the benefits we produce. We think it's all about empowerment of the individual to take part in the individual's health himself by having an understanding of some of the things that are happening to his environment, to his movement, that helps him inform and change practices.
My dad's 94 and he's now in care in Lanarkshire, and until he was 91 he was able to look after himself, and unfortunately he's become more frail during that time. So I want to be able to look after my dad as well as we possibly can, and if we are able to use digital technology in the future to be able to identify patients who are at higher risk and are becoming more frail at a much earlier stage, then hopefully we can look after them better, improve their health and keep them at home living healthy and enjoyable lives. We know that we can't continue to do things the way we always have, and we hope to be able to look after patients better in their own homes by involving digital health and care.
The health and social care world tends to be built on a design which is responsive, and it's really important as demographic changes, as the resources available to invest in services change, that we think differently about being much more proactive, much more informed, understanding patterns, understanding how to keep people healthy, active and well is really going to robustly shape services and responses into the future.
So I think projects like this in the future will help the decision makers better direct the resources and where kind of future investment should go. Again, just going back to basics, prevention is better than a cure, and if projects like this can keep people out of hospital or get them out of hospital and back into their community quicker, then that's not only great for the individual, but it's great for effectively the public and the taxpayer.
Working in the health service all my life, I always think it important when people are discharged from hospital, they have a suitable, safe home to go home to, and it sort of saves the revolving door. So this all ties in with the future of the National Health Service.
To actually do something as described by this project is incredibly meaningful, incredibly important. It's cost effective, and it will improve people's lives and their deaths ultimately.
In terms of our stakeholders would be the University of Strathclyde team, North Lanarkshire Adult and Social Care Services team, North Lanarkshire Council, and also NHS Lanarkshire. In terms of our technology partners, we are working with MediBiosense, so I'd like to thank them. I'd also like to thank DICIT and also Glasgow City Region, our partners AMBA, and a team who are not visible at present but that work night and day to support us.